Interocclusal records with a DENTCA system. We will now review the step-by-step process for capturing accurate DENTCA records. The first step involves cutting the posterior sections off of your impressions. The impressions can then be reseeded to record the vertical dimension of occlusion, and the easy tracer can be used to capture centric relation. Cutting the posterior areas off of your impression can be a challenging concept to wrap your head around as a clinician who has just taken a pristine final impression. This is a critical step, however, as it allows you to reposition your tray and capture your records without interference. You may want to familiarize yourself with the process by gently removing the posterior sections of one of your extra trays before attempting to separate your final impression. To make the process easier, I use the lines on the side of the tray where the tray separates to guide my cuts. This is a useful tip since you won't be able to see where the trays separate underneath the impression material. It is very important to make one clean cut with your blade when going through your impression. If you start and stop or remove your blade, it may affect the scanning process. Also, be very gentle when separating your impression. If you're too aggressive or forceful, you can break the tabs on your tray, which can again negatively affect the scanning process. Bradshaw Part 2. Hey Panat, go to Bradshaw Part 2, 10 minutes and 9 seconds to 11 minutes and 27 seconds. When cutting my impression, I first identify on the side of the tray where the tray separates. Since I can't see the separation where I will be making my cuts, this is the easiest and most predictable place for me to start. When starting the cut, it is very critical to push your blade all the way through material until you feel the tray. This is a similar tactile sensation to when you incise soft tissue to the bone when you're reflecting a flap for periodontal surgery. Once you hit the tray and feel that hard stop, continue straight across from the other side. Do not relieve pressure from your blade or remove your blade during this process. Once you are across to the other side, gently wiggle your tray to separate the end with care not to break off the tabs. Oftentimes, you will have too much impression material in your tray to see the pin assembly. Carefully remove as much material as is needed to fully engage your pin into the clips. The rounded end of the pin should be facing up, away from the impression material, with the flat end down towards the floor of the mouth. Follow the same steps when cutting off the distal ends as you did on the upper when you're cutting through your lower tray. Identify your starting point on one side, engage your blade down to the tray, and completely move across to the other side. You do not ever need to reattach the posterior sections to the rest of your impression. DENTCA will do that upon receipt of your impression when they scan. You do, however, want to make sure that the posterior portions of your impressions are not thrown away. Keep them together in a safe place after separating. It is critical that DENTCA has these portions in order to fabricate your final denture. Next, we're going to capture the vertical dimension of occlusion, or VDO, and centric relation, or CR. Since the posterior sections were cut off, you can now fully seat the trays without interference. The pins on the lower tray rotate higher and lower to open and close the vertical dimension of occlusion. You'll have the patient open wide and rotate the pin as necessary until you achieve the final VDO that you had established previously with your DENTCA jaw gauge and either a vertical dimension of rest or your patient's existing dentures. Once you've established your VDO, you're ready to proceed with jaw relation records. This can be an elusive position for many patients. For all intents and purposes, complete dentures are a full mouth rehabilitation. When there are no teeth or stable contacts to guide you, one of the only reliable, repeatable positions we have is CR. For many years, Gothic arch tracers have been used to accurately capture CR. A Gothic arch tracer is comprised of a central bearing pin on one arch and a flat striking plate on the other arch, typically the maxillary. This technique is predictable and reliable, but it does require some practice, and more importantly, it requires a laboratory that knows how to work with Gothic arch tracers. Fortunately, DENTCA has simplified the Gothic arch tracer and has built it into their trays. The Easy Tracer further simplifies this process. Once you have established your VDO, you'll want to place your Easy Tracer. Before placing, clean the striking plate area of the maxillary tray with an alcohol wipe and dry it. Peel the sticky backing from the Easy Tracer and apply it to the striking plate. The Easy Tracer has a film that peels back, so you can try as many times as you like to trace the CR. If you miss your CR, peel back the film, it clears off your trace, and you can try again. With the Easy Tracer in place, reinsert your upper and lower trays. With the Easy Tracer in place, reinsert your trays. Have the patient move all the way forward, all the way back, all the way to the left, and all the way to the right very slowly, and have them repeat it a few times. If it's done correctly, you will see a clearly defined arrow, as in this case and in the photo shown before. If your tracing does not look like an arrow, peel back the film and repeat. For some patients with a difficult to capture CR, it helps to recline the patient, as lying back helps relax their stabilization muscles, making it easier for the patients to seat themselves in CR. When you're happy with your recording, make a small divot with a round burr at the point of the arrow, which is your CR. It may be easier to see your arrow on the dark layer underneath the film. This divot will provide a stopping point for your patient to catch their CR as you record the position with bite registration pace. Help guide the patient back to CR until the pin catches the divot. You'll then want to stabilize the patient's mandible as the bite pace sets up, so that your patient does not slide out of the CR position. Most commonly, we'll see the patient slide slightly forward out of CR. This can result in an inaccurate recording and will likely result in an anterior open bite, or it will just require a very significant occlusal adjustment at delivery or at the try-in, which will result in an obliteration of your occlusal anatomy. Stabilize the mandibular tray with your thumb in the patient's mouth while lifting up with your fingers under the patient's chin. This helps prevent the lower tray from tilting. Once DENTCA receives your impressions, they will scan and digitize them. Once scanned, the software identifies several points on your impressions. An algorithm is utilized, taking this information and determining the ideal design and setup for your patient, which includes tooth selection, midline, occlusal plane, curve of Spee, curve of Wilson, articulation, and post-dam area. At this point, a prototype of the designed denture, of the CAD designed denture, will be printed with a 3D printer. This 3D printed prototype can be utilized for your patient try-in, or it can be converted to your final denture depending on whether you elected a 2-visit or 3-visit protocol. You are now ready to proceed with your try-in.